Anthony Chibueze Lemadim, consultant pediatrician, currently at the Princess Medical Center here in Port Harcourt. Today we are going to discuss the child with fever. Fever is a very important and one of the commonest presentation of children in pediatrics, and it occurs across board. We're going to say during this presentation what it actually means, that it does not equal to any diagnosis. It simply means that the child is sick. At times you can have a normal fever, but most times it's abnormal, especially in our society, in our terrain, in the tropics here. So I'm going to start with the presentation very soon. The topic is going to be a short topic telling us about the presentation of what happens when a child has fever, and I'm going to use the following contents to go through. I'm going to tell us about the definitions, what causes fever, how fever develops, how it manifests, the clinical presentation, how we investigate as do laboratory tests, then treatments and possible complications of the fever, the mucosa. Okay, so we are going to, as we're going forward, fever simply means that a child has body temperature more than 37.4 degrees Celsius. The normal body temperature is between 36.4 degrees Celsius and 37.4 degrees Celsius. And we have seen that in our environment, our ambient temperature is actually in the tropics is quite high. In some tropics, in some climes, it may be lower. This range may be lower depending on the ambient temperature and what's obtainable there. So commonly we take the body temperature using the thermometer, and we put it inside the armpit, what we call the axilla, and take the temperature. So once the temperature reading is more than 37.5 degrees Celsius, it's taken to be fever. Fever is also known in some cases as pyrexia, feverish. And okay, the other one is that a child is a person who's less than 18 years of age, and that's our jurisdiction. Okay. Now, as I said earlier on, fever is the commonest presentation in pediatrics. It's the commonest presentation in pediatrics, and is a hallmark of body response to infection and inflammation. Infection simply means that there are some microbes inside the body, and inflammation is response to antigens, maybe foreign antigens or foreign bodies within the body, and it cuts across all these body systems, about 8 of them in the body. It's not a diagnosis, as I said earlier, and it's not equal to malaria and typhoid. There's usually a cause. Now, normally it could be as a result of stress. When somebody goes on, has vigorous exercise, a person can have an elevated fever. And also in adolescents who are ovulating can also have mid-cycle fever, but most times is pathological, that's abnormal. And the commonest causes are viruses. The commonest causes are viruses, followed by bacteria. You can remember, we are currently in the coronavirus pandemic, and these days we are talking about Lassa fever, talking about yellow fever, which is now coming out in epidemic proportions in certain parts of the country. They're all viruses. More than 60% of cases of Lassa fever are viruses. Then we now have other causes like bacteria, parasites, fungi, parasites like malaria. These are infectious causes of fever. The other causes include inflammatory causes, maybe those that have hypersensitivity reaction, those that take some medication, some drugs that can increase body temperature or cause fever. Cancers, like those that have Hodgkin's lymphoma, neuroblastoma, brain cancers that can also cause fever. Some endocrine diseases like hyperthyroidism, when the blood level of thyroxine is high, that can lead to increased basal metabolic rate and also increase the body temperature. Microorganisms also have been indicated in this, and in the winter period, in our setting, we commonly have Staphylococcus aureus. That's the common. In other climes, like in temperate regions, common is a group B strep. Now, the other organisms include Escherichia coli and Listeria monocytogenes. After the newborn period, we now have viruses, as I've said earlier on, enteroviruses, adenoviruses, rotaviruses, HIV. Then bacteria, we have the strep pneumonia, Haemophilus influenza type B, Salmonella, Mycobacterium tuberculosis. Then malaria, especially Plasmodium falciparum. That's the commonest parasite, malaria parasite that we have in this part of the world. The other ones is Plasmodium malariae, Plasmodium vivax, and ovale. Okay. Now, there are some diseases, the common diseases that we have, that are commonly associated with fever, and they include respiratory tract infection. Top on the list is upper airway infection, ear infection, or called otitis media, pharyngitis, which is an infection of the throat, infection of the tonsils, tonsillitis, then chest infection, pneumonia. Very common, common diseases that present with fever. Then there are abdominal infections also, like appendicitis. Those that have what we call acute gastroenteritis, diarrhea diseases. Then malaria, as I said earlier, urinary tract infection. When urinary tract is infected, the kidneys, the ureters, the urinary bladder. Then the other diseases like meningitis, which is infection or inflammation of the coverings of the brain. Then septic arthritis, which is infection of the joint. Then osteomyelitis, which is infection of the bone. So these are common diseases that we have. Now, let us look at the physiology of how the body regulates temperature. This is basically done by an organ in the brain that is called hypothalamus. Hypothalamus and some connections, neuronal connections within the skin and the muscles. Now, what this hypothalamus does is that it responds to changes in the temperature of the blood. So if the temperature of the blood is warm, signals will be sent to the skin and have increased blood flow in the skin. And that will lead towards increased sweating. And at the same time, there will be reduced blood flow to the kidneys. In fact, one hormone will be released, what we call antidiuretic hormone, from the hypothalamus through the pituitary gland, released into the system, and this will lead to reduced excretion of urine. That's why if you watch when the environment is warm, when you feel warm, you tend to pass less urine, and your urine appears to be dark. You understand? Dark amber, dark yellow, appears concentrated. Then, following that, the next thing is behavioral responses. You need to go and seek for cold environment, drink cool water, expose yourself. So this is how the body regulates its temperature. Then when the environment is cold, the temperature of the blood is cold. What the body does is that it reduces blood flow to the skin. And at the same time, if that happens, there will be reduced sweating. Body retains energy. There is reduced production of the antidiuretic hormone, and urinates more frequently. That's the body. Then finally, you go on behavioral responses. Go on and cover yourself so you can feel warm, seek warm environment. Now, there's a normal variation of body temperature every day. Usually in the morning, the mean or average temperature for humans is taken to be 37 degrees Celsius. But this usually is gotten in the early hours of the morning, by maybe 4 a.m. As the day goes by, the temperature increases a little bit because of the ambient temperature, increase in environmental temperature, increases a little bit and reaches maybe 37.4 degrees Celsius in the afternoons, between 1 and 4 p.m. Then gradually falls to the nadir, to 37 degrees Celsius in the night. So this is how it happens every day. It's a normal variation. At times you feel that you're feeling hot, touch your body in the afternoon, you feel hot, but you're not really febrile. There's no fever. It's a normal variation, and a lot of things come into play in this, especially the hormones that are being released and your activities during the day. Now, for fever to develop, three things. One of these three things must be there: pyrogens. 2, heat production exceeding loss. 3, defective heat loss. So the first one, pyrogens. Now, pyrogens could be exogenous or endogenous. Endogenous means generated inside the body. Exogenous from outside the body into the body. So these pyrogens, the endogenous ones, are basically chemokines, what we call chemokines. Their moieties are proteins in the body: interleukin 1, interleukin 6, CNF alpha, interferon gamma alpha. These are things that are produced by infectious agents, cancers, inflammatory diseases within the body. You understand? So another one are the exogenous ones, pyrogens, which are actually the microbes, like the bacteria, the parasites, the malaria. Then some medications that can cause fever, like vancomycin, amphotericin B, allopurinol. So these are the pyrogens that can cause fever. Now, when the heat production is more than is being lost, that can also increase the body temperature. Then, if there's defective heat loss, that is, the heat loss is quite reduced, more than is being produced. It can also lead to what? Increase in the body temperature. So how does this happen? For the endogenous pyrogens, what they do, once they are in the system, once they're produced by infectious agents or cancers, they activate the white cells. In our body, we have different types of cells in our body. The white cells are the immune cells. They help us fight infections. They activate the white cells, which go on and produce some lipids, some other moieties within the body. Typical example is what we call the prostaglandin E2. So what these moieties do, they go and attach to the hypothalamus. We're now going to reset the body temperature to a higher temperature. We normally take our normal temperature to be 37 degrees Celsius. It may reset it up to 39 degrees Celsius, 38 degrees Celsius. And what you have, the body will now tend to do what? Start contracting, muscles will start contracting in order to generate energy to reach that new set point temperature. And that will lead to what? Increase of body temperature above normal, fever. Now, for exogenous ones, once microorganisms come into the body, like malaria, which is very common in our environment, they go on and activate some type of cells that are called macrophages, which also release similar, what do you call it, the chemokines, interleukins, that also go on and activate other white cells, which in turn produce, once again, the prostaglandins that are attached to the hypothalamus in the brain and increase the set point temperature to lead towards fever. So when this happens, what we have is that once the set point has been increased, the body will now start shivering. Because shivering is simply that the muscles are contracting. An increase in blood flow, shivering to generate heat. The patients will want to cover the body. The aim is to increase the temperature to the new set point temperature, example 39 degrees Celsius. But once the temperature is reached, the body will now sense that this is not a normal temperature. It needs to come down. Then the body relaxes all the signals that cause the increase in temperature, and the temperature falls down to normal. So this is the cycle of how fever happens within our own body. So the other ones, like the heat production exceeding heat loss, commonly seen in hyperthyroidism, is seen in salicylic poisoning, when there is increased blood flow to the skin and the muscles, and muscles are contracting, muscles are contracting, and it will lead to increased energy production and fever. You understand? Then the other one is the defective heat loss. This is quite rare. It's commonly seen those that do not have sweat glands. Sweat glands are the glands in our skin through which the sweat are excreted into the environment. So when this happens, there will be accumulation of, because of the absence of the sweat glands, the accumulation of heat within the body, and this will lead to increased temperature above the normal range, at least 37.5 degrees Celsius, leading to fever. So in a nutshell, for the mechanisms of this mechanisms of heat loss, we should know, for those that read physics, evaporation. So when the body is sweating, there's change of what matter from liquid form to the vapor form, as we call evaporation. And when this happens, that's heat loss. Then secondly, convection. Because of the increased blood flow to the skin, energy is lost through that axis. Then conduction. This is actually this plays an important role in our management of fever. When we do tepid sponging, that's use water, lukewarm water, sponge the child that is having fever. So that's heat loss by conduction, transferring energy or heat from the body to the water. Then lastly, radiation. When you expose the body, heat loss to other radiating surfaces around the child. So there are different types of fever, and the pattern of the fever helps us in making our diagnosis. The commonest in our environment in the tropics here is what we call relapsing fever. That's the commonest, and that's where malaria fits in a lot. You see, there are spikes of fever, goes up above normal, comes down to normal, goes up again, comes down to normal. Now, these are febrile episodes that are separated by intervals of normal temperature. When it occurs daily, is called quotidian, and it's commonly caused by Plasmodium falciparum, which is the commonest parasite that causes malaria in our environment. When it occurs every 48 hours, it could be caused by Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and that's the tertian fever. Now, the quartan fever is one that occurs every 72 hours. It's commonly caused by Plasmodium malaria itself. So, relapsing fever are febrile episodes that are separated by intervals of normal temperature. Then the other one are continuous fever and remittent fever. Continuous fever is that the temperature is persistently above the normal range. The upper normal, the upper limit of normal we take is 37.4 degrees Celsius. It's persistently above that normal and will be spiking up and down with a variation of less than 1 degree Celsius. And it's commonly seen in those that have urinary tract infection, pneumonia, meningitis. So that's continuous fever. The other one is remittent fever. Remittent fever is like continuous fever, but the variation within the febrile episodes is usually more than 2 degrees Celsius. But all the temperature are above the normal range. So we see that in many viral infections. Many viral infections. Today we're talking about coronavirus. Most cases are like that. Also, we see that in many bacterial infections. Then those that have tuberculosis also have that. Can also have that. Then there's some cases of what we call infective endocarditis, which is inflammation of disease of the lining of the heart or the heart itself. You can also have this kind of remittent fever. Lastly, intermittent fever. Intermittent fever is simply an exaggeration of the normal secondary reading of temperature in the body. Remember, I told you earlier on that in the mornings temperature appears to be around 36, 37 degrees Celsius, reaches up to its peak in the afternoons around 37.4 degrees Celsius, then comes down in the night. Now, in those that have this kind of fever, intermittent fever, it tends to be exaggerated. It shoots up during the afternoon period. The temperature shoots above normal. Then when it's coming down, it goes down below normal, less than 6.4 degrees Celsius. So that's intermittent fever. And it occurs daily. So it's commonly seen in those that have abscesses. Those that have deep-seated infections, like abscesses within organs, like in the liver, in the brain. Also those that have drug fever, those that have malignancies, cancers. So we use thermometers to check this temperature once a patient comes to the hospital, and there are different types of thermometers. The common ones that we use and are called clinical thermometers. That's mercury clinical thermometer, the digital type, and infrared. The infrared is becoming very common these days because of the epidemics and pandemics we've been having. Started first some 5-6 years ago. We had a Ebola pandemic that was infrared everywhere. You must have seen it in airports, in churches, in mosques, like a gun. Flashes you the thermometer. So the other ones that we use are mercury thermometer and digital thermometer. That's the other ones that we use. The mercury thermometer is, if you can remember, when you go to the hospital, you see the nurse shaking a stick like that. That's the mercury type thermometer. And digital type is the one that you press. You press, the nurse will press, it makes a kind of clicking sound, goes inside the armpit. Then it reads, after which the reading is taken. Now, there are different sides one can put the thermometer. You can put in the armpit, put in the mouth, the oral type. Then for newborns, can put in underneath the skin, You can put in the rectum also, you can put inside the ear canal. But in children, because it may be quite, they may not be able to tolerate all these sites. The best site that we use is the armpit as the axillary site. And the temperature that we get there is somewhat 0.5 degrees Celsius, more than that of the core temperature. The core temperature is the major temperature within the body. So, for clinical investigations, for one to get the root of the matter why the child is having fever, we need a very good history, very good examination. Oftentimes, the only complaint may just be only fever. But for us doctors in the hospitals, we go on further to ask other ancillary questions to know if we can pinpoint any particular system that is affected. Because what we do is that we treat the cause of the fever, we don't treat fever per se. Because if you're treating only fever, fever will continue. If you don't treat the cause, alright. So, starting from the neonatal period, when we think that a child, a newborn newborns are persons who are less than 28 days old, and the first 28 days of life. So when we are asking questions, we ask questions pertaining to whether the mother had infection during pregnancy or during delivery. Such questions like, was there any fever? Was the body very hot during the delivery or got intrapartum pyrexia? Was there any bleeding during the pregnancy? And how long was the bleeding? When did you see your water coming out? Was it foul smelling? What was the color? Was there any foul smelling vaginal discharge? How long was the labor? Questions that may help us to know whether there's any risk factor for infection that will help us to manage the child, the baby very well. The other ancillary questions, symptoms may be poor feeding. Child may appear very weak, not feeding well. There may be cough, catarrh, difficulty in breathing, especially if it's pneumonia, chest infection. There may be difficulty in passing urine or pain when passing urine if there's urinary tract infection. If there's ear infection, there may be pain. To touch the ear, the child will start crying, or there may be discharge, some whitish substances coming, or yellowish substances of fluid coming out from the ear canal. There may be vomiting, diarrhea, that's frequent passage of loose or watery stool, abdominal pain or swelling if there is evidence of abdominal infection, like those that have acute gastroenteritis or diarrhea diseases. There may be convulsions, excessive crying, headache, neck pain for those that have infections of the brain or coverings of the brain. So these are the questions that we ask whenever we see any child with fever. So we tend to pinpoint where the problem is coming on. So once the child comes into the hospital, we take the vital signs. And the vital signs include the temperature. As I said earlier on, the temperature, we use thermometer to do that in the hospital. The other ones include to check the pulse. Pulse rates also tend to increase as the temperature is increasing. The respiratory rate, if the respiratory rate is more than normal for that particular age, that may be a pointer that child may be having what? Chest infection, pneumonia. And blood pressure, especially those that have urinary tract infection, if there is infection of the kidneys, that can lead to hypertension. Also, we'll go on and do a pulse oximetry to check the oxygen level in the blood. Then the other ones that we do include systemic examination. After doing this general examination, we'll do systemic examination looking at the systems. Respiratory system, cardiovascular system, central nervous system, digestive system, so many of them, to check if there is any involvement of these systems that may cause fever. Now, the laboratory investigations that we do, which are available in Princess Medical Center here, include blood film for malaria parasite. Now, this is very important because yes, we are living in a malaria endemic